Let's talk a little bit about the cost of health insurance. You know, we hear a lot about this today. You're hearing it from all quarters, Washington, D.C., your local newspapers, televisions, everything. We hear a lot about health insurance and the cost of health insurance. But what really drives the cost of health insurance? Two things: unit cost and utilization. Those are the two things that drive health insurance. And let's look at something. Back in 1960 in this country, we paid 48% of our health care costs out of pocket. 48%. You know how much we pay today? 13%. We have moved toward a European model where the health insurance companies cover basically everything with a copay. That's where we're at today. That's where you get the Cadillac plans, and you hear about all these plans and plans that you may be on at the state or in your business, whatever the case may be. We've moved toward a situation where only 13% is actually paid out of pocket now. Well, when you compare health care in 1960 to health care today, that's kind of like comparing hamburger to filet mignon. Let me explain. In 1960, there was no Lipitor, there was no Crestor, and there was no Simvastatin. So when people had high cholesterol, they either died because they didn't know they had it, or they went and had a massive operation and spent a lot of money and 6 months recovering from bypass surgery because their arteries were clogged. Today, we have statin drugs. Simvastatin, Lipitor, Crestor, Zocor, go down the line. They cost money. They cost money to be developed, but they're life-saving drugs and they make a huge difference. Weren't available in 1960. Look at asthma. In 1960, if you had asthma, you might wind up in an iron lung if you were a child. My wife, when she was a teenager, was in an iron lung because she had asthma. Today, we have Advir, Flovent, all these different medications, albuterol, that can prevent the issues with asthma from becoming critical. We can manage the disease. Again, these medications aren't cheap, they cost money. So again, we've got unit cost here. Cost is going up because we're administering disease control with these drugs. Here's one that's very interesting. You'll find this interesting, especially when you look at what we call socialized medicine in the European countries. Stutent is a drug by Pfizer. That drug for a course of treatment for breast cancer costs about $50,000. $50,000. It's covered by every insurance company in this country because it's recommended by the American Association of Oncologists, therefore it's covered. Do you know in the United Kingdom you can't even get that drug? It's not covered under their health care plan, but it is covered here. So $50,000 for a course of medication that could save your life if you have breast cancer is very, very different than what we see in some other countries. But that's the cost of health care. That drives the cost of health care. Some other things that we see that are very different here in this country in the way we manage health care and the health care that we have available to us, which I happen to think is the best in the world. But let's take a look at something like the Da Vinci robot. The Da Vinci robot, St. Luke's Health System has 4 of them. There are 12 of them between here and Wichita. Guess how many there are in Canada? None. Guess how many there are in the UK? There's 1. It's in Edinburgh, Scotland. That's a $1.4 million piece of equipment that allows surgeons to sit in one room and do surgery on you in another room. It's remarkable. If you have esophageal cancer in the past, it may have been inoperable. Today, with the Da Vinci robot, they can save your life. It cuts down recovery times by 2/3. It cuts down infections by 2/3. It's a remarkable machine. Costs $1.4 million. And then the doctors get to go to Harvard, Yale, Princeton, whatever school, medical school, and they get to spend a year training on the device. I've had these doctors on my radio program. It's remarkable what they do. But that's the level of technology that we've come to in this country and the level of health care that we've come to in this country. So when I say filet mignon versus hamburger, I think you see what I'm talking about. That's where we are today. So how do we become better consumers of health care? Well, for instance, back to the HSA plan that the folks at Tiny Tykes Furniture are on now. If they go to the doctor and the doctor says, they take their child in to an emergency room, let's say the child was in a softball game and he turned his ankle and they don't know if it's broken or if it's sprained. And the first thing the emergency room wants to do is, let's do an MRI. $1,200. Well, what if the parent says, hold on a minute, I love my child, I want to make sure he gets the proper care, but could we do an x-ray first and see if he's got a broken ankle? Because it'll show in the x-ray, $150. If you're the consumer of health care and you're paying for that out of your pocket, you might want to take a look at that $150 x-ray versus that $1,200 MRI. Okay? There's a big difference. The least effective dollar that we spend in this country on health care is in the emergency room. The least effective dollar that we spend is in the emergency room. And where's the first place people go? The emergency room. But it's the least effective dollar that we spend. So becoming better consumers of health care helps hold cost. Let's go back to an MRI. If you get an MRI in a hospital, it's going to run probably $1,200 or $1,400. If you go to a freestanding clinic, it's going to be about $750. So now you're a consumer. You know, we shop for everything in this country, from shoes to cars, you name it, we shop for it. Go online to shop for cars, go online to look. My wife orders shoes online. Okay? I mean, people shop for things, and they shop for everything in this country, but we don't shop for health care. That's one of the reasons why the costs are where they are. So when you look at where we were after World War II and where we are today with the cost of health insurance, a lot of that is driven by the way we consume health care. If you just have a copay, I don't care if it's an MRI or an X-ray, but if that's your nickel and you've got skin in the game, now you care. That's becoming a better consumer of health care. And that's where we have to go if we're going to be able to manage health care costs. Next slide. One of the biggest problems that we have in this country is disease management. 80% of the claims are driven by 20% of the people. 80% of the claims are driven by 20% of the people. That's an astounding number, isn't it? That 20% is what we need to be concentrating on. And when I walk into a business, and the classic story that I like to tell is I walked into a business one day, and the gentleman asked me to come very early in the morning, where I got there about 7:30, 8 o'clock, and all these people, they were mostly all women, they had a huge area of cubicles, and they processed claims, medical claims. I thought that was kind of interesting. And so I walked in, it was about 8 o'clock in the morning, and the woman at the front desk was sitting there with a huge bag of potato chips, and she was eating potato chips at the front desk. Boy, that's kind of interesting. So he went in and sat down, and he started telling me his tale of woe about his health insurance costs. And I said, "Can I ask you a question, Stan?" I said, "Can you tell me about your wellness program?" And he kind of gave me a blank stare. Now, he had 50 employees. I said, "Tell me about your wellness program." "What wellness program?" So I opened the door and I looked up and down the thing and I said, "Come here a minute." I said, "You see all these people out here?" I said, "How many of these do you think are pre-diabetic? What do you think of the lady eating potato chips for breakfast? And where do you think you're at on your wellness program? And where's your 80% of claims being driven by 20% of the people?" He has no idea. They don't have a wellness program. If he had a wellness program where people filled out a health risk assessment form, which is totally confidential, they would then be able to identify where their issues were. So whether it's a small group and you don't have an HR director, or whether it's a large group and you do have an HR director, a health risk assessment form and a meaningful wellness program can make all the difference in the world. You know, I've had St. Luke's Hospital on the radio with me for probably, I think this is our 5th year with St. Luke's. And there's a lady there that manages their wellness program. It's one of the most aggressive wellness programs in the city. If you want to smoke a cigarette at St. Luke's, you have to walk a block and a half off campus to be able to do it. There are no French fries in the cafeteria, all right? And they promote wellness. And you know what's happened as a result of that? They've held their increases to 6% or less for the last 3 to 4 years in their cost of their huge plan. Thousands of people on their plan. But they have an aggressive wellness program. Disease management, understanding and identifying the problem is what's going to allow you to lower cost. Look, an independent broker could come in and make rain by moving you from policy A to policy B or showing you a better way of doing it, just like I did at Tiny Tykes. But what's going to happen 3, 4, 5 years from now if we have the same behaviors that got us where we are? You're going to wind up with the same problem again. The wellness programs are available from the insurance carriers. They're free. Insurance carriers have great wellness programs. That's not totally altruistic. There's a reason for that. They know it drives down claims, right? So it makes a lot of sense for them. But it makes a tremendous amount of sense for us and a tremendous amount of sense for our clients because it helps hold cost. It's the one single thing we don't do. And in the current legislation, the Federal Patient Protection and Affordable Health Care Act, not one of these issues is addressed. Unit cost and utilization is not addressed at all, and neither is the wellness issue. although they're not going to be more copays for wellness, but that's not what we're trying to do here. What we're trying to do is get people involved. And companies that do a health risk assessment form, where the carrier or the person in charge of the wellness program can go back to the person and say, you know what, you're pre-diabetic, you've got some problems, you probably didn't even know that. Or a smoking cessation program to get people involved to stop smoking, or identify people that have cholesterol problems and triglyceride problems. That's all part of this. And that's where we have to go if we're going to become better consumers of health care, and we're really going to be able to hold the cost of health insurance down. Because if you got rid of all the health insurance companies in the entire country today, you would garner about $17 to $20 billion if you got rid of all of them. Do you know how long that would provide health care in this country for? Take a guess. 2 weeks. 2 weeks. Unit cost, utilization. What does it cost? How much of it do I get? Those are the two issues. If we don't get those two issues under control, whether it's in our business or in our country, we're not going to be able to control this monster we call healthcare. However, we have the greatest healthcare in the world. And you know, I've seen the UN reports and I see the rankings and all the rest of it, but let me ask you a couple of practical questions. Why is it when Roberto Berlusconi, the premier of Italy, needed heart surgery, he came to Cleveland Clinic to get it and didn't stay in Italy? They got a great program. Why didn't he stay there? Why did Michael Williams, the governor of Nova Scotia, sneak out of Canada, fly down to Miami to get surgery on a Da Vinci robot instead of having it in his country? And when the press found out about it, he said, I didn't want to get in front of anybody in line. And then he got belligerent and angry and said, I'm entitled to the best health care I can get. Uh-oh. Uh-oh. What does that mean? Maybe that Canadian system isn't all that in a bag of chips. So he goes down to Florida to get his health care. I still believe that we have the best health care in this country. And it's because of things like the Da Vinci robot. It's because of the medications we develop. It's because of the superior doctors and nurses. It's because of award-winning hospitals like St. Luke's Hospital. It's those kinds of facilities that allow us to have that health care. But it's important for us to understand how to become better consumers of that.